Thank you for joining us today for Healthcare 101, the impact of AI in healthcare. I've got Dwight French joining me today, and we are going to dive right in. Dwight, give me an example of why AI is important and how it might be used. So let's say we've got a patient named Tommy, and Tommy's at his pediatrician. How could they interact?
Sure. We've all been in the situation where we've met with our doctor and they spend all this time with their face in front of the computer system, and we don't get a chance to really interact with them. And let's say Tommy's pediatrician just doesn't have the time to be able to go and research his records because he saw an elevated blood pressure and was concerned about that. And he knows that to have a hypertension diagnosis, there needs to be at least 3 consistent readings of elevated blood pressure. So in this situation, Tommy's pediatrician has access to a system, an AI-based system, that he can simply ask that assistant to do the question and to go research for him. And within a matter of seconds, he says, hey, does Tommy have hypertension? Well, the AI assistant knows to go and look at all of his medical records, and in fact finds out that there were 4 elevated readings of elevated blood pressure, and comes back and says, yes, in fact, Tommy has stage 1 hypertension, and then provides all of the interventions from the clinical-based guidelines for the doctor to recommend to Tommy going forward.
Knowing that gives the doctor more time to focus on the patient, Tommy in this case. It gives Tommy better results because the doctor is able to more quickly analyze all that's going on with him. Is greatly beneficial across the board. Right. But if I take a step back and I'm looking at it, as someone who's not deeply technical, how does that work? How do we know they're bringing in the right information and the right data points?
It's a very good question, Emily. Let's start unpacking the technical solution that enabled this conversation using a simple metaphor. So imagine you have a magic library that helps doctors find the right information about their patients when they have questions. This magic library uses special tools to give the most helpful answers. So let's break down how it works using some cool ideas. First, RAG, or Retrieval Augmented Generation. This is like having a super smart librarian. When a doctor asks a question, the librarian quickly gathers valuable books and papers from the library. Then it uses the information from these books to help write a clear and helpful answer. Second cool tool is a graph database. Think of this as a giant web or map showing how all the information about a patient is connected. So for example, it shows how patients' symptoms relate to their medical history. This helps the librarian find meaningful answers because it considers everything together holistically, not just in individual pieces. The third cool tool is embedded vector indexes. These are like secret codes for describing what the information is about. So imagine if every book and article had a special code that tells what it's about. This would help the librarian quickly find similar and relevant information when the doctor asks a question. And then FHIR, or Fast Healthcare Interoperability Resource. This is a source of standard medical terms and how they are all related to each other. And this is a way to ensure all the information in the library is stored neatly and organized, like a well-arranged bookshelf. It makes it easy to find and understand the data about a patient, even if it comes from different places or times. And last, LLM, or large language model. This is something we've all heard a lot about the last year. And it's like the brain of the magic library that reads and understands all the information the librarian gathers. When the doctor asks a question, the brain can read through the information and explain it in a way that's easy to understand. So when a doctor asks the magic library something like, what should I know about Tommy's health? The system works together like this. The RAG finds all the essential information about Tommy and helps create an answer. The graph database checks connections between Tommy's symptoms and medical history to give that context. The embedded vector indexes quickly locate information similar to Tommy's situation. The FHIR framework references standard medical terms and keeps everything organized and accessible. And finally, the LLM takes all this information and crafts a meaningful and understandable answer for the doctor. Together, these tools help the doctor better understand Tommy's health and make informed decisions quickly, just like having a magical, super smart library at their fingertips.
I'm sitting here listening to you thinking, I need a magic library. How do I get one? So when I take my kids to the pediatrician next time, we can go nice and quick, get in, get out, figure out what's going on with them. Well, thank you for joining me. We are going to have a whole bunch of these coming on out to dive into different topics. We're going to be recording one on AI and prior authorization, for example, getting into the technology. So please feel free to join us for other sessions. Others, we hope you enjoy this and learn something from it. You can also go to redhat.com, and there is a healthcare page that can show you how you can use our technologies in your healthcare business. Thanks for joining us.
Thank you.